Good morning, everyone. My name is Amna, and I'm going to be talking about my practicum experience at Island Health. And so basically, Island Health is one of the 5 regional authorities in British Columbia, and they serve over 790,000 individuals. So my project was to create a quarterly evaluation tool for the community health networks, which in this presentation, I will be referring to as CHNs. So here is the outline for my presentation. I'm going to start by acknowledging all the individuals who helped me complete this project successfully, and then I will move on to project background, and then I will discuss the methodology used to create this evaluation tool. And then I will talk about the evaluation tool components, and then finally conclude my presentation with challenges and recommendations. Okay, so I'm going to start off by, thanking Annalisa Blake, who was my supervisor at Island Health, for the constant support and assistance she provided me throughout my practicum experience. I would also like to acknowledge the CHN leads and Betty Tate, and I would like to thank Dr. Nigel and Dr. Karen for the comments that greatly improved my culminating report, and also Dr. Caitlin for making sure I complete my practicum in a timely manner. And last but not the least, Betty Taylor for helping me, find a practicum and making sure it all goes well. So, so the next few slides will provide a brief background to help understand the scope of my project. I will start off by providing an overview of the community health networks on the island, and then I will talk about Island Health's role in their development, and finally I will talk about why their initiatives should be evaluated. So since 2006, Island Health has been encouraging the development of community health networks, and Mount Waddington was the first CHN. And since then, there are currently 9 community health networks, as you can see in the picture below. We're just missing Nanaimo because it was developed this year. And so basically, community health networks are multi-stakeholder, geographically based groups which consist of interested citizens, community groups, nonprofit organizations, and First Nations. And what they do is they develop strategies and implement strategies that address social determinants of health and modifiable risk factors, and they positively influence community health and wellness. And they recognize that no one individual, agency, or group can effectively address complex issues on their own. So what is Island's Health role? So basically, Island Health provides limited financial support and in-kind commitments to set up community health networks. For instance, once Island Health provides funding for a CHN coordinator, they help by they assess, encourage, and come up, plan for collective action on shared goals. But CHNs have been able to leverage additional funding from local government and other partners. Island Health also provides consistent and ongoing leadership to CHNs. For example, continuous involvement from CHN leaders as member of Table of Partners is required through all 4 stages of the CHN life cycle. In addition, Island Health acts as committed members or as content experts providing support on an as-needed basis. So Island Health's investment in community health networks influences community involvement, investment in health creating healthier communities, and ultimately decreasing downstream healthcare costs. So why should we evaluate their initiatives? So as we all know, it is important to gather data on the effectiveness of community health networks to support ongoing funding from Island Health and other partners. And in addition, evaluation of community health networks will identify strengths and weaknesses, improve implementation, measure achievements, and make decisions about whether the CHN should be continued or discontinued. So since 2016, the community health networks have been submitting quarterly progress reports to Island Health. In 2017, an annual reporting tool was, introduced. So the current evaluation tool uses an Excel sheet model, which we only obtain qualitative data from it. So as we all know, analyzing qualitative data is time-consuming to analyze, and a data administrator may be required for that type of work. And a quarterly evaluation tool, as identified by their plan, should be comprehensive and should include process and outcome indicators for CHNs in order to determine their return on investment that they are trying to achieve through their collective work on community health networks. Moving on. So a combination of process and outcome evaluation was conducted using a mixed methods approach. Process evaluation, as we can see here, include basically focuses on the first three segments of the logic model, so inputs, activities, and outputs, and it answers questions like whether the program is implemented as planned, and also whereas outcome evaluation focuses on the last three segments, including short-term, intermediate, and long-term outcomes. And outcome evaluation will answer questions like, are the efforts of the CHNs resulting to measurable outcomes as identified by the continuum of change? So continuous feedback from the community health networks was incorporated in the development of this evaluation tool. Moving on. So this slide basically summarizes the final major components of my evaluation tool. After several revisions, the tool consisted of three major components. We actually had like about 5 or 6. We had to cut down a few after feedback from the CHN leads, as they felt that the one I had proposed before was too long and too time-consuming to fill out every quarter. Moving on. So this table basically compares the current evaluation tool used by the community health networks and the new evaluation tool that I proposed. As you can see, we have added more process indicators. So moving on to challenges and recommendations. So just to provide you with some background, so every quarter the community health networks will fill out the evaluation on a web-based electronic survey called Checkbox. And then data from Checkbox will be exported to an Excel template that I created, and then the results will be shown using interactive dashboards. But there are some challenges in using Excel. First of all, Excel is a spreadsheet tool, and it is not on par with other data visualization tools. And it is difficult to share a spreadsheet among many CHN leads, as there may be version control challenges. For instance, if somebody deletes a cell or makes an edit by accident, it is very hard to determine where that document or when it was edited. And also, despite several training programs and videos online, people still do not find Excel user-friendly. And last but not the least, I've used pivot charts to create interactive dashboards. And for those of you who have used pivot charts in the past, know that every time new data becomes available, you have to update the pivot charts manually. So my recommendation in the future revision would be to use something like Tableau or Smartsheet, because those are actually data visualization tools. And also, my recommendation would be that we should incorporate an IT resource from Island Health in the implementation process in the future. So collaboration, so basically community health networks leads were included in the feedback process because their opinion is highly important and they will be the ones using the new tool. However, there were some challenges. For instance, the collaboration process took longer than anticipated, but at the same time, involving CHN leads at an early stage and the developmental process would ensure compliance with the evaluation tool in the future. So that brings me to the end of my presentation. Thank you for listening. And are there any questions?
Questions? Thank you, Amna. That was amazing presentation, and you've done a lot of work. My question is, did you find it challenging getting people together at the table? Like, I find anytime when you have to work with multiple departments, getting them to one table at the same time, it's very, very challenging. How did you accomplish that? Because that's kind of hard.
Thank you so much for your question. Actually, that was very challenging for me as well. But what we did was we hosted 2 teleconferences because it was really hard for me to, I guess, have a one-on-one meeting with all the CHN leads as they were all, I'm actually from the Lower Mainland. So most of the meetings were done on the phone. But honestly, collaboration was a huge challenge as I identified earlier. And, well, thank you for your question.
Thank you so much for the presentation. It was so interesting and super insightful. I was just wondering if, as a part of this process, you worked with the health authority to develop indicators for the evaluation.
I didn't get a chance to, but what I had actually their continuum of change. And so basically, while researching, I identified that using the logic or like the logic model was the best way to find indicators, like to find the process and outcome indicators. And that's where majority of my questions came from. Because all the community health network leads were familiar with the logic model.
Thank you.
Excellent presentation. Thank you very much. This is a huge challenge you've taken on. How do you balance the different perspectives about what's important? Like, there are like political perspectives. There are like the executives at the health authority are going to want to make sure that you're addressing something that might be very different than what the community health network leads are interested in, and what might be very different again from what Annalisa needs to know from her perspective as a manager. So how do you balance all of those different perspectives and end up with something that works for most or all, if you can?
Thank you so much for your question. I actually found that highly challenging too. But what we did during the proposal, and so basically initially I had to come up with a prototype. So what I did was I sent out a survey to each CHN lead, and they basically voted on questions that they would like to see at the end. So the question that received like the most, questions that received majority of the votes, we ended up putting those in like the final, prototype. So I guess that's one technique, but I'm still working on, finding other ways. And I guess that was one of my learning goals, was to actually just like address, issues when collaborating with various stakeholders.
Great. Thank you very much.
Thank you so much.
The mic in a second.